The Department of Health, or DOH, warns the public about buying and consumption of fake medicines as they may have adverse effects on health.
Ever snatched up a deal on medication online and wondered if you really got what you paid for? You're not alone. Counterfeit meds are a global issue, affecting millions with false promises of healing. Imagine reaching for a pill, only to realize it's a fake, a risk that could cost more than just money. Stay with us as we unveil 15 of the most alarming fake medications and arm you with the knowledge to stay safe. Before we begin, hit that like and subscribe button, or you might just end up with a prescription for placebo likes and fictional subscribers. No cure for video disappointment in sight. Number 1. Fake antibiotics.
Undersecretary Maria Rosario Vergere, fake medicines do not contain actual ingredients or components that will cure illnesses.
Around the world, counterfeit antibiotics are a silent killer. They may come in bottles that look real, but what's inside could be useless or even dangerous. These fake drugs might not have any active ingredients, meaning they can't fight off infections. Sometimes they have just enough medicine to make harmful bacteria stronger, leading to antibiotic resistance. This is a big deal because it makes it harder to treat everyday infections in the future. People taking these phony pills might think they're getting better, but instead their illness drags on. Or they could face unexpected side effects. The worst part? These fakes are hard to spot, especially where drug testing is not up to par. They sneak into pharmacies and markets, fooling patients and disturbing the trust we put in our healthcare. Fake antibiotics hit pockets too, costing more dollars for extra doctor visits when treatments fail. So what can we do? Well, raising a flag on this issue worldwide and tightening up our drug laws can help. Plus, there's cutting-edge tech that's joining the fight to spot these counterfeits fast. By staying informed, we can steer clear of these medical masquerades and help keep everyone safe. Number 2. Counterfeit cancer drugs.
Online pharmacies stopped operating today after federal investigators tracked counterfeit cancer drugs.
The fight against cancer is tough, but it's made even harder when patients are given counterfeit medications. These fakes often lack the essential active ingredients needed for treatment. Picture receiving a drug you believe will save your life, but instead it does absolutely nothing, because it's not the real deal. Shockingly, this happens in all corners of the globe. Cases like the 2012 discovery of fake Avastin in the United States shook the medical community. Online pharmacies with less regulation become easy channels for these dangerous knockoffs to reach desperate patients. This isn't just about ineffective treatment. These drugs can cause serious harm, allowing cancer to progress unchecked or introducing toxic substances into the body. And the costs? They extend beyond health. There's a financial toll on healthcare systems and a loss of trust in the medical supply chain. Both are priceless. Global efforts to stamp out this illicit trade have seen increased collaboration and stiffer regulations, with organizations like Interpol and WHO at the forefront. Yet, despite law enforcement's best efforts, the battle wages on. Access to legitimate life-saving treatments remains a critical issue, with counterfeiters exploiting the high demand for affordable cancer drugs. Number 3. Fake antimalarial drugs.
Over a fake anti-malaria drug, quinine sulfate, circulating in West and Central Africa.
Across malaria-stricken regions, counterfeit antimalarial medications pose a deadly threat. Often indistinguishable from the real thing, these fakes range from having no active ingredients to wrong doses, leaving millions vulnerable. High in demand, the market is flooded, some places seeing up to 30% of such drugs being fake. The consequences? Devastating. Not only do patients suffer treatment failure, risking severe disease and death, but these drugs can also aid the terrifying rise of drug-resistant malaria strains. And the economic impact is harsh, inflating the cost of fighting malaria. How do we fight back? It starts with stringent regulation and stronger law enforcement against criminal networks behind these fakes. Tech solutions like SMS authentication can empower patients to verify drug authenticity. And education plays a pivotal role. Awareness campaigns informing where and how to buy legitimate treatments. This global issue calls for a united front, rallying governments, international organizations, and each one of us in the battle against counterfeit antimalarial drugs. Number 4. Counterfeit HIV/AIDS medications.
53-year-old man in Germany showed no detectable virus in his body after stopping his HIV medications for more than 4 years.
These dangerous fakes are a global health crisis, posing severe risks to patients relying on antiretroviral drugs to manage HIV/AIDS. The heart of the issue lies in what these counterfeits don't do. They fail to suppress the HIV virus effectively due to incorrect or missing active ingredients. This failure doesn't just weaken the fight against HIV, it also paves the way for the virus to become resistant to current treatments. Devastating blow for future care. The health hazards extend beyond ineffectiveness. Some fake drugs contain toxic substances that could cause serious health issues, or at worst, be fatal. The economic toll is significant too, with patients spending precious funds on bogus medications and health systems draining resources to combat the fallout of these fakes. But efforts are underway to tackle the problem. Stricter regulations, cutting-edge detection technology, and public education are keys to this fight. International partnerships are crucial, bringing together the World Health Organization and law enforcement to stamp out these life-threatening counterfeits. Remember, always source medications from trusted providers. Stay informed, stay safe, and help keep these fakes off our shelves and out of our bodies. Number 5. Bogus erectile dysfunction pills.
30 million men in the U.S. are affected by erectile dysfunction.
Behind the allure of enhanced performance, a darker truth lurks. Counterfeit ED medications have flooded the market globally. They're not just ineffective, they can be downright dangerous. These pills often contain the wrong amounts of active ingredients or none at all, replaced sometimes with toxic substances. The consequences for those duped into buying them? Not only a continued struggle with erectile dysfunction, but also potential exposure to health risks that could be fatal. International law enforcement works tirelessly to combat this illicit trade, but the sophistication of criminal networks dealing in fake meds makes the battle tough. Adding to the complexity, these drugs cross borders with ease, turning a health risk into a global crisis. As consumers, the message is clear. Steer clear of shady sources. Legitimate pharmacies that require prescriptions are the only safe bet for obtaining ED treatments. Falling into the trap of counterfeit pills can leave more than your health compromised. It's a danger that's alarmingly easy to underestimate, yet one that can carry grave consequences. Number 6. Counterfeit painkillers.
One pill could easily contain enough fentanyl or carfentanil to kill someone.
Here's a chilling reality. Fake pain meds, masquerading as your common prescription opioids, are flooding the streets globally. These knockoffs, often hard to distinguish from the real deal, come with a deadly secret. They're spiked with fentanyl, an opioid so potent a pinch can be fatal. Now imagine someone in pain, seeking relief, unknowingly buys these pills. What they think is a standard dose of medicine is actually a lethal lottery ticket to an overdose because of the unpredictable fentanyl mix. Drug dealers bank on fentanyl's cheapness and potency to crank up profits, but at the cost of lives. Yours, mine, anyone's. Law enforcement's cracking down and public health campaigns are on the rise. But the counterfeit tide is strong. What can you do? Stay vigilant. Only trust meds from legitimate sources. Remember, when it comes to painkillers, what you don't know can indeed hurt you. It's not just a problem, it's a global emergency as counterfeit pain pills claim lives each day. Stay safe, stay informed. Number 7. Fake diabetes medications.
Some are turning to unauthorized dealers to get their hands on the drugs. Mike Benson says a counterfeit drug nearly killed him.
The danger of counterfeit diabetes drugs lies in their failure to control blood sugar, a tightrope walk for those managing the condition. Imagine taking what you believe is your lifeline, only to find it's a sham. Some of these counterfeits contain little to no active ingredients, leaving blood sugar levels unchecked and paving the way for devastating complications like heart disease or kidney failure. Others might be laced with harmful additives, triggering immediate health crises or setting the stage for long-term damage. These knockoffs don't just shake confidence in the treatments, but can erode trust in entire healthcare systems. Authorities worldwide are on high alert, fortifying the defenses through regulation, enforcement, and public awareness campaigns. They stress the importance of sourcing medicines from trusted pharmacies. Remember, the ripple effects of counterfeit diabetes medications go beyond a single pill. They pose a threat that can destabilize lives and communities. It's a global health challenge that demands a global response, a battle where staying informed could be our strongest shield. Number 8. Counterfeit birth control pills.
In a post-Roe world, contraceptives like birth control are taking center stage.
It's a stark reality that the pills women depend on for family planning, if fake, can result in the exact opposite: unplanned pregnancies. But the danger goes beyond surprise. These counterfeits might pack harmful ingredients, leading to health risks we can't afford to take. They often mimic real medication, making it tough to spot a fake at first glance. Picture this: a rogue pill looking identical to the one you trust, but it's an imposter. With shady online markets, it's easier than ever for these phonies to slip into our lives. No quality checks, no assurances, just false security in a bottle. The solution isn't simple, but it starts with awareness. Stick to reputable pharmacies, stay sharp for odd packaging or pricing, and always talk to your healthcare provider for safe medication sources. The fight against these dangerous doppelgangers in our medicine cabinets, it's ongoing, and it's serious. As for these counterfeit creators, it's a game of cat and mouse, with enforcement agencies continuously on the chase, ensuring our next pill is safe, not sorry. Number 9. Counterfeit vaccines.
Criminals are taking advantage of the situation by creating fake versions.
In our fight against COVID-19, counterfeit vaccines have emerged as a dangerous threat to global health. These fake vaccines can look deceptively real, but they may contain harmful substances or none of the real vaccine's protective ingredients. The risks are stark. People injected with these phonies don't gain immunity, remain vulnerable to disease, and can experience serious side effects, even death. Health authorities have uncovered alarming instances across the world, from Mexico to China to South Africa, where criminals have sold saline solutions or other bogus concoctions as life-saving vaccines. To combat this, global law enforcement, like Interpol, is cracking down on these fraudulent operations. They're seizing fake doses and dismantling the criminal networks behind them. Meanwhile, track and trace technologies are being ramped up to safeguard the vaccine supply chain. Public education campaigns are crucial too, helping people recognize and avoid counterfeit vaccines. This maintains trust in vaccination programs and protects the health of individuals and communities alike. As we navigate this pandemic, staying informed and vigilant against counterfeit vaccines is more important than ever for our health and for the world's recovery. Number 10. Fake psychiatric medications. The threat of counterfeit psychiatric drugs is a silent crisis with loud repercussions. Imagine being prescribed medicine meant to ease your mind, only to find it's not just ineffective but potentially dangerous. These medications, meant to treat conditions like depression or anxiety, could contain incorrect ingredients or incorrect dosages. This puts patients at risk of their mental health conditions worsening. Not only do fake drugs fail to treat the illness properly, but they can also cause severe adverse reactions or lead to treatment resistance, making the condition harder to manage in the future. Moreover, when patients discover they've been receiving fake medications, their trust in the healthcare system can shatter. This breakdown of trust leads to disengagement from necessary treatment services. The economic burden is yet another blow, wasting valuable resources on ineffective treatments and potentially incurring even higher costs for further medical care. With a prevalence in low- and middle-income countries, fake psychiatric drugs also slip into high-income countries, undermining the integrity of even the most robust healthcare systems. Global efforts, therefore, are intensifying to clamp down on counterfeit medications with better regulation, technology, and public education to safeguard mental health treatments. Ensuring the authenticity of psychiatric medications is critical in maintaining both the sanity of the patient and the health of the wider community. Thank you for joining us as we uncovered the alarming world of fake medications. Your health is invaluable, and staying informed is key. If you found this video informative, don't forget to like and subscribe to stay updated on our future content. Stay vigilant and only trust reputable sources for your medications. Together, we can combat the global issue of counterfeit meds. Thank you for watching.